Hello, everyone. Good afternoon. Welcome to the LTCCC's Family Empowerment Hour with my beautiful and talented co-host and co-worker, Gloria Murray, my Family Empowerment teammate. And we're joined today by Dr. Wong from the New York State Health Department. She's going to be giving us some really much needed information for this sniffle season and answering some questions. I hope you can bring some questions with you. We do have some questions from registrants that we'll be trying to get to during this hour, but we'll also take some questions from people live. So please do bring us your questions. Thank you. Gloria and Dr. Wong are here, and we look forward to a really good, inspired hour of question and answers about the season, the sniffle season, and how to keep safe and keep our residents and loved ones safe.
Great, Janine. Thanks.
Great. Is that my cue?
Yes, go for
All
it.
right, great. Hey,
All right.
thanks so much for having me. Let me quickly try to share my screen here. Let's see if this works as well as it did before. Okay, is that looking okay?
Yes.
Great.
Great.
Yeah, thanks so much for having me, and thanks for the invitation to come. So I'm Dr. Marsha Wong. I'm from the New York City Department of Health, and I was invited to talk about the upcoming respiratory season and just providing some updates and talk about ways how you can protect yourself and your loved ones. I have to say, just because this is being recorded, that the information today is based on our knowledge as of today and is subject to change. So we're going to start with COVID-19 updates. I know we're all very tired of talking about COVID, but it is still around. So I just wanted to kind of catch everybody up with where we are right now. So as you can see, you've probably noticed, and we've definitely seen it sort of in the nursing home and adult care settings where we really have seen increase of COVID cases. You can see here that the line is basically going up. It's been going up in the last few months. We also anticipate another surge as we approach the winter months. And as you may have heard in the news, we are not only worried about COVID, but also flu and RSV, which is another respiratory virus. So we want everyone to have the tools to protect themselves and their loved one as much as we can this winter season. So right now, I know this is a busy slide and you don't really have to know much about it, except that to say all these are different variants, COVID variants that we're seeing. They are all still related to Omicron family. And so we're seeing a bit of like alphabet soup right now, but they are all closely related to, if you've heard in the news, this XBB Omicron variant. And this is important because this year, the COVID vaccine that just was approved, I think a couple of weeks ago, specifically targets this specific variant XBB. And so it will provide protection against sort of this alphabet soup of variants and will provide the best protection to the variants that are circulating right now. So we are continuing to monitor this both at the city level, state level, as well as federal level. So as you can see here, this is COVID hospitalizations by group in the United States. You can see a time along the horizontal axis, and then sort of on the vertical axis, you can see sort of the cases. And you can see that the blue line at the top here is for those 65 and above. You can just see this huge gap of most, people 65 and above are just so much more likely to be hospitalized for COVID, much more than other age groups. And also most deaths from COVID are occurring among those 65 and older. So now we're just going to mainly talk about vaccines. So the 2020, they're calling it the 2023-2024 updated COVID-19 vaccine, but I will just call it the updated vaccine because that's quite a mouthful. So anyone 6 months and older can get the new updated COVID vaccine, which protects against the most recent variants. And right now, Pfizer and Moderna, so the two mRNA vaccines, are available for 6 months and above. And the FDA is reviewing an updated Novavax vaccine as well. The Novavax vaccine is kind of uses more so traditional vaccine technology. So it's what we call a protein-based vaccine. So if people are still worried about the mRNA, Pfizer, Moderna vaccines, Novavax may be an option. So people can get, as of now, people can get Pfizer or Moderna regardless of what you received before. And right now, this is the only COVID vaccine available. The previous sort of any boosters in the past, the original vaccines, the bivalent vaccine last season, all of those are no longer available. So right now, we just have this one updated vaccine. So remember, vaccines are safe, effective, life-saving, strongly recommended. If there are any questions at all, if you want to discuss your particular situation or your loved one's situation, we still have the 212 COVID-19 line. And COVID vaccines will remain free for most people. It is through their health insurance right now. And so it's a little bit of a change, but most people should be able to get the vaccine for free. And it really should be covered by their health insurance at no cost. So in order to be considered up to date, everyone needs to get this updated COVID-19 vaccine. And people who are moderately or severely compromised also need initial doses for the initial series, and also can get additional doses of the updated COVID-19 vaccine. And sort of specifically when looking at nursing home residents, so those not up to date, with their COVID-19 vaccines were up to 50% more likely to get COVID compared to those who were up to date. So even though it's not 100%, it does offer protection to nursing home residents from first getting COVID in the first place. And if they do get it, really preventing them from being hospitalized or dying. So I just want to quickly go over some common questions regarding the updated vaccine. So why get it if you've already gotten previous vaccines? COVID, similar to the flu, does change over time. So we will expect that we will have to continue to tailor the vaccine to whatever is going around, similar to sort of the annual flu vaccine. And the updated vaccine is more specific to the current XBB variants and their relatives, so it boosts the immune system to recognize the current variants and fight COVID more efficiently. So why get it if you can still get COVID? Like all vaccines, nothing is 100% at preventing infection, but it does decrease your risk of being hospitalized or dying. It decreases the severity of symptoms, how long you have them, as well as decreasing the risk of long COVID. And I just want to remind people, I know that first wave of COVID, which I know was a really traumatic time, particularly for nursing homes, adult care facilities. No one had any kind of immunity. And the reason why we aren't seeing the amount of COVID hospitalizations and deaths is largely because of vaccines. What I'm hearing now from nursing homes is that people are getting COVID, but they're just so much less sick and really have pretty minimal symptoms compared to what it was in that first wave when we didn't have any kind of immunity to this virus. So what if you've already had COVID? If you've had COVID in the last 3 months, you can consider waiting since it's pretty rare to get COVID again. But this protection does decrease over time. So if it's been more than 3 months since you got COVID, you should consider getting an updated COVID vaccine. Or potentially if you are going to be traveling, doing something where you might have a higher chance of getting COVID, you can get your vaccine sooner. But this is just sort of up to you. You can get it right after you've had COVID if you want to. It's not dangerous to do so. But it is rare to get COVID sort of right after you've just had it. Okay, so now we're going to just quickly go through treatments. Just because there is treatment out there, and I always like to remind people that treatment is available. So both COVID and flu have treatments that work similarly by lowering the amount of virus in your body, reducing symptoms, and preventing hospitalization. They work best the sooner you take it, so get tested for both if you do have symptoms. It's not a substitute for vaccination, which still remains our best tool against both COVID and the flu. And just some data, those who were prescribed treatment for COVID, this was mainly looking at the first line treatment called Paxlovid, were 50% less likely to be hospitalized than those who did not receive Paxlovid. So people who have diagnosis of COVID with symptoms and are at increased risk of severe COVID are eligible for treatment. I think almost everybody, unless you really don't have any health conditions at all, almost everybody would probably benefit from Paxlovid. And honestly, anybody like 50 and above probably could at least should consider the medication. So call your healthcare provider to get treatment for COVID or flu. And if you don't have a healthcare provider, you can call the 631 Express Care. And there's a number of pharmacies that also can do sort of like they test you for COVID, and if you do have it, they can offer you treatment as well. So that's called the Test to Treat program. That's a federal program. So remember, we have many tools to prevent the spread of respiratory infections, including vaccination, getting tested if you have symptoms, masking, and staying home if sick, good hand washing, other additional tools, considering increasing ventilation, opening windows, using fans, or using air purifiers. So we have a number of tools that we can deploy sort of during this season. So now we're going to pivot a little bit and talk briefly about the flu. So let me skip this slide just because I'm short on time, but did prevent a lot of, the flu vaccine does prevent a lot of cases. It prevents a lot of hospitalizations and a lot of deaths. And so that's why we always, every year, really emphasize the importance of the flu vaccine. Again, it's not 100% effective, so you can still get it, but similar to the COVID vaccine, it decreases symptoms if you do get the flu, decreases the chance of ending up in the hospital or dying, and also prevents people from spreading it around. People can have the flu and not have symptoms, but still pass it on to others. And, the common question, can I get the flu vaccine from the flu shot? It cannot give you the flu. It's a killed vaccine, but a lot of people do get sick right after the flu. It might be due to like a side effect of the vaccine. It might be another virus, or it might be the flu. It does take a couple weeks for your body to respond to the vaccine to start protecting you from the flu. But so many other winter viruses are going around. I think often people mistake sort of their cold virus for the flu virus, but the flu virus is actually a very specific virus. So we are encouraging people to get the updated COVID-19 vaccine and flu vaccines at the same time. It's safe to do so, to get both at the same time. That's what I did last year. And it's then you also know you're protected against both viruses. Okay, there are the two other respiratory related viruses that people should consider. Anyone 65 or older should receive at least one pneumococcal vaccine. People 60 or older should also consider getting the new respiratory syncytial virus, or RSV vaccine. It's just another common respiratory virus, but that can spread and is pretty common and can cause hospitalizations and deaths. So both of these prevent hospitalizations and deaths in older adults, and you can talk to your healthcare provider to see if the vaccines might be right for you or your loved ones. Okay, so basically, I do want to leave time for questions. So basically, being up to date on vaccines is really the best tool we have. Everybody should be getting their updated COVID vaccine. Vaccine Finder is still working. I think we're working on updating it. I think we're a little bit behind, but hopefully in the next coming weeks, you'll be able to find your COVID vaccines on there. Get treatment if, consider treatment if you do have symptoms and if you are diagnosed with the flu or COVID. And again, Express Care is an option if you don't have your own healthcare provider. The 212 COVID-19 hotline is also working. Okay, so these are just some resources for information. And I will stop there for any questions or whatever else you have planned. I'm not sure what structure you want to do next.
Thank you, Dr. Wong. We do have a few questions, even including in the chat. Kathleen Gerard from Rhode Island asks if, just to make sure I'm sure, a small percentage with COVID will get Paxlovid as well, yes?
It's sort of a double question. I was tagging on to Irma's question that there are so few nursing home residents who have gotten the updated vaccine. There was just an article in the Times about that today. And there was an article some time ago about what a small percentage of nursing home residents with COVID have gotten Paxlovid. So I'm wondering what is being done to help that population.
Yeah, I think it's really hard. I think we are trying to do as much outreach as possible, sort of with the staff we have, to really do outreach to nursing homes, reminding them to get their vaccines, reminding them that there is treatment. And, you know, there has been a lot of messaging to sort of nursing home medical directors. So it's hard to know what the barriers are. Obviously, there's particularly among staff. I think the nursing home residents, depending on the nursing home, can range from something like 20% to something like 80%, at least in New York City. We did try to look at this data. Of course, that data sort of depends on the reliability of reporting by nursing homes to different sort of data sets. But that's sort of the sense that we've gotten, at least in New York City nursing homes. So, you know, trying to sort of target those for outreach with sort of the lower numbers. Staff is always challenging. Obviously, we do a lot of staff outreach. We are trying to join, you know, this season. I will say, like last year, we were a little bit hampered by sort of the Mpox emergency response that happened in the summer through the fall. But this year we are trying to be better in terms of timing, and we would love to be able to come to any staff meeting, you know, in a nursing home, in an adult care facility. You know, we're making ourselves available to join staff meetings. I think that's been the best outreach in terms of, rather than having like a citywide webinar that we set up, it seems like joining staff nursing homes may be the way to go, but that also requires somebody like reaching out to us to set that up. But we're happy to do that outreach. I have a team that sort of is set up to do more of these presentations with actually the same slide deck for the most part. So yeah, it's definitely an issue. We're trying to work on it, you know, sort of coordinating with the state as well, because I think they spend a lot of time in the nursing homes. So, you know, really trying to get the word out there that we're happy to make ourselves available for education. In terms of Paxlovid, yeah, it's really hard. I think when people have pretty minimal symptoms, it's hard to, I think, for people to really be like, oh, we should definitely give them treatment, or maybe it doesn't cross their mind. I think I've heard that a lot. We still do really want people to be treated. It obviously prevents hospitalizations. The other, and I don't want to get too much in the weeds of Paxlovid, but Paxlovid can be a little bit challenging to give, only because it can have some medication interactions, and it does have to be thought through carefully in a nursing home population. And then next option is actually an IV medication that's given over 3 days, and that's like really challenging to do, although not impossible. So I think there's still some work to be done there. But really Paxlovid, yeah, I think it is a big concern. I know the state is also very worried about, you know, just the low uptake of Paxlovid in the nursing home settings. I'm open to ideas, like we definitely mentioned treatment in our education, but it's, you know, in terms of prescribing practices, it's hard to change those.
And it's a national problem. So to
Yeah.
put that on individual municipalities like you, do you know if CMS or CDC are doing anything to that end?
I don't know. And I don't even know how the data is tracked per se. I think, so the question is sort of, I think it is tracked to some degree. But yeah, I don't really know if CDC or really anything CMS is really going to do too much about this. You're thinking about like regulatory kinds of things, like Yeah, this is
don't know
beyond the scope
what's
of what
within there.
I know in terms of regulatory. I know there are certain things that can be regulated. I'm not sure, metrics for, Paxlovid treatment or vaccination. I might think that'd be nice, but I think it's going to be really hard to have that be put in
Okay.
a regulatory kind of situation.
Well,
That's-
thank you for that, Dr. Wong. And thank you, Kathleen, for this. It's something that we're working on, and we know the government and the states are working on. Thank you for that. Charles Gourget in the chat had asked, what is the best time to take the vaccine, right away or in mid-October for the protection to last longer into the season?
Yeah, I think that's up to you. Everyone does it a little differently. If you want to be very prescriptive about it, I do like to do sort of mid-October, as you mentioned, as particularly for the flu, because sometimes flu season can last into the spring. And so I try to, this is very nerdy, but I tend to follow the epi curves, which are, you can see the flu cases kind of go up over time, and that is publicly available on our flu website, on the New York City website. And so I kind of just keep an eye out of when I really see the flu cases start to climb, and that's sort of when I get my flu vaccine. That's the thing. I think COVID cases are really high right now. So it may be worth getting now, but we are also anticipating a winter surge. So it's really hard, I think, to decide when to get it. I personally am probably gonna shoot for like mid-October, which really is only 2 weeks away.
Yep.
And just get both at the same time.
That would be another question that we had wanted to ask you. Do you stagger them or you get them both at the same time?
I would get both at the same time. It's more, again, that's a personal decision. But for me, I don't really have bad reactions to the vaccines. And so I'm happy to just get them at the same time, because I'm usually pretty short on time. So one visit is always better than 2 visits.
Yes. All right. Thank you. You just knocked out 2 of our questions. Thank you for that, Dr. Wong. Another one of our attendees had asked, they received the Pfizer bivalent in July of 2023. Are they eligible for the new vaccine currently being offered now?
Yes. If you got a bivalent, and that's all you got, and you have not gotten the updated one, I think not very many people have gotten the updated one because it's so new. It's only been like a week or 2. You are actually considered not up to date anymore. So you're not up to date on your vaccines until you get, so I am not up to date because I have not gotten my vaccine yet, but I will probably in the coming weeks. But yeah, so I am not considered up to date. You are not considered up to date. So everybody should be getting this new updated vaccine.
Thank you. That is heartening advice and sobering advice, and I'm sure we will we'll stick to that. I just wrote down, I'm going to do it in mid-October. Thank you for that, Dr. Wong. Another question that was asked from one of our registrants was, communicating with masks, should it come down to that nursing homes and assisted living homes as well have to wear masks, the residents or the visitors, their loved ones, they have to wear them. Communicating with masks is difficult, especially when residents are hard of hearing or have cognitive disabilities, because they're not seeing your mouth move and your facial expressions. Does the health department have any thoughts on masks? Is masking going to be something that you recommend during the months that come when the COVID increases in these residences?
So I think that's so masking, as you know, has kind of been political.
Yes.
I will say I don't believe there's any regulations in regards to masks. So no one is sort of required to wear a mask. With that said, it's pretty good public health practice. We still would recommend wearing masks. And I think the places where we really, really recommend wearing masks is if you have COVID and you're outside of your home and you're out of isolation. I think right now the recommendation is, you isolate for 5 days if you have COVID and then mask for the remaining 5 days. The other place where masking is recommended is, or more strongly recommended, is if you've been exposed to COVID, then the recommendation is also to mask during that time period when you have been exposed and could potentially kind of test positive for it. Short of that, I don't know. It's really up to the individual policies of individual hospitals, individual nursing homes, whether or not they want to put in a mask policy in place or not. I can't really comment on policy too much, but it's still like a very strong public health recommendation in regards to the spread of respiratory viruses.
Thank you for that. Irma, I see that you are actively putting things in the chat. Would you like to ask a question live? Irma Rappaport?
Sure. I just wanted to make it easier by putting it in the chat.
Oh, okay.
I think that you have explained a lot, Dr. Wong, and in a very reasonable way. It's just a lot of us on here are martyrs from the COVID lockdowns, and it still stays with us.
Yeah.
And we saw windows being kept closed when, as you're saying, ventilation was important. We're seeing staff not getting vaccinated, and yet we were locked out when most of us got vaccinated, most residents got vaccinated. And we just don't want this to happen again in the future. That's very much in our minds what's happened, that there'll be other things in the future, even if COVID goes away. So having something that's very firmly in place that makes facilities and hospitals know what the rules are really supposed to be. And also the general public seeing, I wasn't on Facebook until I started with trying to make sure that residents were not left isolated again without their loved ones. And since I've been on Facebook, I see all those, I was mentioning in the chat, all the conspiracy theories about the COVID vaccine that is making people not get it. And who knows how bad it would be now if more people had gotten their vaccines and boosters. So
Make a good point.
Yeah, I think I don't really have an answer. Again, I can't really talk too much about policy, and I also don't really control any policy. It's really more of a state level. But just to really acknowledge the trauma that nursing homes have really gone through. And it's really unprocessed, I feel like, in terms of we feel like everyone's sort of moved on, and like we haven't really, even as a society, really like tried to process this like kind of global event. So yeah, just to kind of acknowledge that. And I think acknowledging, and I'm not an expert on, building vaccine confidence by any means, but I think sometimes like acknowledging some of that trauma, correcting people as much as, I know you asked a question about sort of conspiracy theories. Some of it is protecting your peace. Like if you're like, this person, I'm never going to convince this person, it may not be worthwhile, but sometimes just stating like, like I see that you saw, that you said this, that is not the, here's a fact that I happen to know. Here's the actual facts. There's lots of, I know that mRNA vaccine is, I think it's less so now, but at the beginning, the mRNA vaccine was very like, oh, it's a new technology. People were very worried about it. Now it's been given to like millions and millions of people. And I used to have slides like really breaking down the mRNA technology and what it is. I mean, our bodies make mRNA all the time. Like that's just a normal part of our body functions. So trying to sort of unpack some of that and acknowledging sort of the traumas and the, some families are facing like structural inequities and racism and all of that that's built into, our society. And so sometimes acknowledging some of those things and acknowledging where they're coming from can be helpful. But these are very like work intensive and also sort of individual relational conversations.
Thank you, Dr. Wong.
Yeah.
Eric, you have your hand raised.
Yes, yeah. Hi. I have a lot of questions, but I'll limit myself to one here. And this is I'm going to open this question to really anybody who wants to answer. But a lot of this is out of our control, the COVID rates, the flu rates. But as family members of nursing home residents, is there anything that can be done as far as working with the nursing home, whether that's just to make sure you know what's going on, or to maybe set up better PPE, or to get information on vaccinations and make sure that that information is getting to other family members and other residents? Is there anything that families can do to kind of to take a little bit more control of the situation? We're still in September here for a couple of days, but before it inevitably, I shouldn't say inevitably, but before it likely spreads.
You know, I think that's open to other folks. I don't work in the nursing home, so it's hard for me to know the avenues of advocacy. So maybe I'll open that up to the group.
That's good to know, because frankly, there isn't a lot going on in terms of direction for visitors and residents of nursing homes. So I think it's really up to families and our family. This is a family empowerment Zoom. Most of our audience are family council members or ombuds people, or just people living with a loved one in a nursing home or an assisted living residence. So it's good. We have to take it into our own hands to protect ourselves and our loved ones. So I think you're giving some good advice. We can't wait for the direction. We have to take it ourselves. And that's what family councils have become about, right? Just propelling ourselves forward and advocating. Kathleen Gerard asks, does New York City or New York State currently track the weekly number of COVID cases in long-term care residences?
Yeah, we both do. It's really more with New York State. I don't believe it's publicly available, but in general, the cases tend to follow whatever's going on in the community for the most part.
Okay. And I know during COVID, go ahead, I'm sorry.
No, go
Oh,
ahead.
no.
Sorry, that was
ahead,
me. I wonder if those numbers were made public for each facility, if that might incentivize facility administrators to be a little more cautious and work a bit more to prevent spread.
Yeah, I don't think we have the data power right now or the people power to make that available, like especially at a facility by facility level. I think there may be some national data that is publicly available that could be looked up by like anybody on the web.
CMS has it, but it's
Yeah.
they release it 3 weeks after.
Oh, okay.
So it's not
Yeah,
useful.
I think that's sort of the best source. I think it's, yeah, I think it's going to be really challenging for either us or New York State really to publicly post that data. I don't know if there's advocacy channels to do that, but I also think it's challenging. I guess going back to sort of the advocacy, I think, like small things, obviously, for families, have your family be vaccinated and do everything you can to maximize your protecting your loved ones. I think also, sort of individual level things like, okay, if my loved one were to get COVID, what's the plan? Like, how do I get Paxlovid? How do I, and sort of talking through that with their medical provider, and thinking through that. So having like, they always say like, for hurricane preparedness or emergency preparedness, like have a plan. I think you can also do something similar for and think about what tools are going to be used for COVID as well, or the flu. Checking with their provider to see, okay, can I get Tamiflu if they get the flu, like what's the plan for that? So trying to understand as much as your loved one's medical care as possible. The other things that can be done, talking to facilities about, like, what's their signage during the season? And I think you may be able to look at vaccination rates publicly, I think maybe on CMS as well. And also, like, again, we're happy to come present. So if you want to be like, hey, have you reached out to Department of Health for education? We're happy for them to email us. So.
And when you say present, you're talking about presenting to a nursing home or an assisted living residence.
Yeah, like at a staff meeting.
So let me just throw that out there. Would you consider a family council presenting it to a family council at a nursing home or assisted living residence?
I think we would if there's good attendance. I think we've tried in the past and it has been challenging, and attendance has been really, really low.
Okay.
So I will put that out there. It depends on the attendance, I think. But I think we would be open, given kind of bandwidth. I think we would probably really try to work with staff first as a priority, because, exactly as you said, like the low rates.
Yes.
And to some extent, I think staff also advocate for their residents. But yeah, I think if there's bandwidth, we'd be open.
Dr. Wong, can you talk a little bit or just address the hand washing versus the sanitizer? Both effective?
Both are effective, yeah.
All right. I mean, we're
Yeah.
still seeing, some deficiencies in the hand washing, and we know that we want to prevent infection in these facilities. So families always do get a little concerned when they just see sanitizer, not staff hand washing. So if you're saying they're both good and valuable in preventing, that's what I think we need to understand, is that they are both well in preventing diseases going from room to room, because that was a big problem.
Yeah, and I don't know the data for, hand washing, but the recommendation is, the 20 seconds with soap and water. And then if you can't do that, then the hand sanitizer, but people have to make sure they get enough of it. It's not like a drop, it's like a handful. So yeah, I feel like New York State does some things with staff with hand washing. I think that's really more under the purview of New York State, because they're visiting the nursing homes. But yeah, I think it's challenging, because I think people are more likely to use hand sanitizer when you have to sanitize so much. And just as in my work as working in the hospital, it's much easier to use hand sanitizer, and also better for your skin, I think, in general. Like, it's really hard to wash for 20 seconds, and availability of sinks and things like that. So at least in a medical setting, I think, just for ease of use, because people are less likely to use something that's hard to use. So I think for all those reasons, people tend to use more hand sanitizer.
Right.
I'm not saying it's better or worse. I'm just saying that there are practical reasons.
Yes, understood. Thank you. Thank you for addressing that.
Does anyone here have any other questions of Dr. Wong?
One more question. I do. Dr. Wong, in the nursing homes or the assisted living, flu symptoms, COVID symptoms, similar? Do they test everybody when they're having the symptoms and then decide if it's COVID, or do they let the symptoms ride out and say it's the flu?
Yeah, and I will say CDC, I think, was going to make some kind of algorithm for this, because it is challenging. I think the safest thing is to test for both. especially in a nursing home setting, because I think there is so much overlap with symptoms. They can look the same. And also you want to get folks on treatment if they do test positive. And so if you can't tell between COVID and flu and which treatment to start, I think, you really want to get like a more clear diagnosis. I think, and again, I can't really comment. I think people are hopefully developing some guidance around this, especially with like COVID rapid testing. Because if you COVID rapid test and they're not positive and you're thinking about the flu, I think sometimes people just go ahead and start Tamiflu. But I don't think there's very clear algorithms surrounding that right now. We're hoping they'll come out in the future.
Okay, thank you. Thank you very much.
Have our incredible team at LTCCC put up a sniffle season tip sheet on our website, on the LTCCC website. And I think the link might be coming up in the chat if you want to take a look at that. Look at that. Thank you, Haley. And Eric also from our team put up a reminder that you can get more free COVID tests from the government. So take advantage of that, because they're not going to sit there unused. It's coming, and we've got to visit our loved ones, and we want to make sure we keep ourselves safe before we go to a concert or dinner or what have you. So just get those free COVID tests, please. Thank you, Richard. This is a fascinating conversation. Thank you, Dr. Wong. We don't often get to talk to someone up there who knows what's going on. So thank you for sharing your wisdom and your frank advice with us. Please, if you haven't already checked out everything we've got a ton of fact sheets, a ton of information. And I'm being serious. LTCCC really tries to give us as much information, and I don't want to say arm, but to arm us with knowledge and know-how. So when you walk into a long-term care residence, you know what you're talking about, because many times the people working there don't. They just work there. They're too busy working to keep up with policies and the acumen that you can find on the LTCCC website, which is, of course, nursinghome411.org. Genius URL forever and ever. Any last questions from anyone? Janet? No? Okay. I know that people are seeing COVID notices go up in the residences. Try to breathe. It's going to happen. And just take care of yourself. Don't bring it in. And if you feel sick and you're not sure if it's a cold or allergies, perhaps don't visit your loved one that day, because we can't risk bringing that into to these residences. Our poor residents have had so much time in isolation. We need to be there for them, healthy, in a healthy state. Thank you, everyone, for joining us. If there are no other questions, any other questions? No? I've got to just tell you that Gloria and I have been working on a really good guest for next month. Next month is Residents' Rights Month. October is Residents' Rights Month for long-term care facilities, and we have a very cool guest speaker lined up for you. We won't say much because we want you to come back.
Right.
I want to see you at the end of October. But please know, bring your questions. It'll be Resident Rights Month all month next month. And we need to keep them educated and keep ourselves educated to take care of them.
And Janine, I just
yes.
want to say, we have.
Oh, yes, we have.
I have to unblur my screen because we do have finally our family council brochure, which is amazing. So we are very excited that it's here, and hopefully we'll be getting it out, or if you need some, to give us a call. It's fabulous. It's got a lot of information, and here's the best thing too, is this statement right here. Let's empower families so residents get the care they deserve. That's what we're all about. That's why we're here. So thanks to Richard and Haley and Eric for their great designs. And I just got my packet today. Thank you.
So exciting. So exciting. Thank you,
And as
everyone.
Sally says, it's coming to 411 soon,
Yes, soon.
soon.
Exactly. So look out for it. I'm sure it'll be up by October. So thank you, everyone, for joining us. Thank you, big hearty thank you
Yes.
to Dr. Wong for sharing your acumen and your frankness and your candor. God bless you. Thank you so much.
Yeah, thanks for
Thanks,
having me.
everyone.
Stay safe, everybody.
Thanks.
Take
You
care.
bet.
Bye-bye.